No. In general, it is not easier for an undocumented immigrant to qualify for Medicaid than it is for a U.S. citizen. In fact, federal Medicaid rules make it much harder for undocumented immigrants to receive Medicaid benefits. For most U.S. citizens, Medicaid eligibility is based primarily on factors such as income, household size, age, disability, pregnancy, or other eligibility categories. If a citizen meets their state's financial and program requirements, they may qualify for full Medicaid coverage. Undocumented immigrants, however, are generally not eligible for full federally funded Medicaid, regardless of how low their income is. Federal law prohibits states from using federal Medicaid funds to provide comprehensive Medicaid benefits to undocumented individuals, with only a few limited exceptions. The biggest exception is emergency Medicaid. Emergency Medicaid pays only for treatment of a qualifying medical emergency, such as emergency labor and delivery or a life-threatening illness or injury. It does not provide ongoing coverage for routine doctor visits, prescriptions, preventive care, or management of chronic conditions after the emergency has ended. Some states use their own state funds, not federal Medicaid dollars, to provide limited health coverage for certain undocumented residents, particularly children or pregnant women. These programs vary widely by state and are not available everywhere. Florida Medicaid. Since your Medicaid questions are about Florida, the rules are especially restrictive. Florida does not offer full Medicaid benefits to undocumented adults. An undocumented individual may qualify only for emergency Medicaid if they meet the financial eligibility requirements and have a qualifying medical emergency. Otherwise, they are generally not eligible for comprehensive Florida Medicaid coverage. By contrast, a U.S. citizen who meets Florida's Medicaid eligibility rules may receive full benefits, including primary care physician visits, hospital services, prescription medications, preventive care, laboratory services, mental health treatment, long-term care services, if otherwise eligible. One reason people sometimes believe undocumented immigrants receive more benefits is that hospitals are required under federal law to stabilize anyone experiencing a medical emergency, regardless of immigration status or ability to pay. Receiving emergency medical treatment, however, is not the same as being enrolled in full Medicaid. In summary, a U.S. citizen who meets Florida Medicaid's eligibility requirements generally has a much broader path to full Medicaid coverage than an undocumented immigrant. Undocumented immigrants are usually limited to emergency Medicaid for qualifying emergencies and do not have access to the full range of Medicaid benefits available to eligible U.S. citizens.